This short lecture is to give you a brief overview of bonded amalgam restorations, polishing, and the removal, which we will do in your simulation session. So some of the learning outcomes that we'd like you to be able to understand at the end of this small lecture is to be familiar with the technique used for bonded amalgams, be able to consider when a bonded amalgam might be indicated, and also to understand what the limitations of a bonded amalgam are. This is not something as an OHT that you would do very frequently, but it is very important that you understand the technique should the need arise. So why bond amalgams? There are a couple of reasons, but one of the main reasons is that conventional amalgam does not restore the fracture resistance of a tooth that was lost during cavity preparation. As we all understand, the more we remove of a tooth, the less strength the tooth structure actually has. Popping an amalgam in doesn't necessarily mean that we have restored the strength of that tooth completely. So to overcome this, the adhesive systems that bond to the enamel and dentine were introduced. Just going to give you a short history of bonded amalgams. Initially back in 1897, they had what was called Baldwin's technique. This is where they painted the cavity walls with thin coal of zinc phosphate cement and then condense the amalgam immediately on the wet surface. And that they found improved the retention and the seal of the amalgam. The concept behind these techniques previously have not changed hugely. However, our materials have gotten a lot better over the years. In 1976, there was Zardiaka's technique. This was developed using a selective interfacial amalgam liner and combined the components of a polycarboxylate cement with some amalgam alloy particles. The development of the amalgam bonding came with the development of metal adhesive resins, which used to be used for fixing Maryland bridges to teeth. So hence they were initially better than amalgam, and they did achieve an increased bond strength and reduced microleakage. So the bonded amalgam technique, and this is what we'll be doing in your simulation exercise. The method involves etching the tooth surface, followed by a primer application. And that's only if your bonding system doesn't already have a primer application included in it. You would then follow with the bond. Most of the Generation 4 bonding systems do already have the primer combined with the bond. The bond type should be chemically activated because this is not a restoration that we are going to cure as we would with composite resin. The amalgam is then condensed on an unset adhesive, and the resin liner will then lead to the mechanical interlocking. The adhesive resin adheres to the amalgam roughness and then micromechanically, which forms a rigid physical bond, while with the dentine, it forms a hybrid layer. So traditionally, when we use an amalgam, we put in undercuts. We shape our restoration to form a mechanical bond between the amalgam and the tooth structure. By adding that adhesive resin, we achieve a micromechanical bond between the two. And that's where our difference lies. Some of the bonded amalgam materials that we might use, some of the adhesive bonding agents, there's one that we call 4-meta, and that's the general ingredient that we find in most bonding materials. GC Fuji Plus, which is the one that you will find in your CQU simulation laboratory. There is also OptiBond Solo. There is a specific one made for bonding amalgam and aptly named Amalgam Bond. Or there is a Scotch Bond multi-purpose. There is a whole array of different ones. These are just a couple of examples for you that are commonly used. So the advantages of a bonded amalgam. The idea is that we can conserve more tooth structure by reducing the need to remove sound tooth tissue for mechanical retention. This is most common in large amalgams that we might need to do. If we are already borderline very, very thin on the walls of our cavity, and we don't want to go that extra mile by taking out some undercuts and removing tooth structure that we don't need to, a bonded amalgam may be a good way to go. It just removes the need for all of that. So that does increase the amalgam retention. It also seems to reduce some marginal leakage. So as we are condensing the amalgam into the cavity, combined with the bonding agent, the bonding agent will slowly squeeze itself up towards the margins. And when it does that, it actually creates a really nice seal between the amalgam material itself and the tooth structure. This in turn can reduce marginal leakage. It also reduces the need for dentine pins. Years ago, and still to this day occasionally, it used to be commonplace to use small amalgam pins. These are about 1 millimetre or 2 millimetres long, and they would place those directly into the dentine structure, having half in, half out, and that would actually help to retain the amalgam in the position that it needed to be in. The issue with dentine pins is that every time we place something into tooth structure, it interrupts the dentine tubules, it interrupts the enamel prisms, and can also reduce the strength of the remaining dentine and enamel. Potentially, it can reduce sensitivity as we have a nice layer over the pulp, and it can also improve fracture resistance. So some of the indications for the use of the bonded amalgam technique, it's not actually recommended just for routine amalgam cavities. Generally, you can do a relatively small amalgam cavity prep, place your little undercuts in, and you'll get that sufficient mechanical retention. It is useful for large multi-surface amalgams to avoid the use of pins if we need that added retention. It can also be really useful for amalgam repairs. So if you have a sound tooth and it's simply fractured, the amalgam is simply fractured as opposed to there being recurrent caries, you can leave what's there as is, because we all know that if we remove restorations, we always tend to need to remove a little bit more healthy tooth tissue. So yeah, this can help amalgams bond to each other. There are some limitations to completing bonded amalgams on teeth. It is very technique sensitive, so we need to be very careful when we're doing this in our simulated environment that we don't flood the cavity with bond. Okay, we only need a very small amount, which is very similar to what we use for a composite. Adhesion may break down over time, so that could possibly cause a little bit of microleakage after a few years. There is also the increased cost of the restoration to the practice itself, and that's due to the use of extra materials. We will go through that a little bit further when you're in your simulation class, and you can ask any questions you need there. Why do we polish amalgams is the next question. I have a little YouTube clip here that I'd really like you all to watch because it is it's self-explanatory.
This video will demonstrate amalgam polishing on a typodont. An amalgam can be polished 24 hours after placement. Here is an unpolished amalgam on the left, compared to a polished one on the right. Polishing amalgams will create a smooth cavo surface margin, reduce biofilm retention, resist tarnish and corrosion, and increase the longevity of the restoration. An abrasive greenstone or a large round burr can be used to prepare the surface for polishing. A rounded end is preferable to avoid putting grooves in the occlusal surface of the amalgam. The burrs we use are latch type. Latch type burrs require a contra-angle attachment on the slow speed handpiece. Place the burr in the contra-angle and twist until it is fully seated. Close the latch to hold the burr. Tug on the burr end to ensure it is held fully in place. This is to ensure that the burr does not come out in the patient's mouth while working. We will be using the Shofu amalgam polishing system. There are points and cups in 3 stages of abrasiveness. The points and cups are called brownies, greenies, and super greenies. They will be used in this order, with the most abrasive brownies used first. Examine the amalgam restoration with an explorer to detect any rough surface anatomy or margin defects. If the restoration has a rough surface, use the green stone to smooth out the defects. Care must be taken not to put too much pressure on the amalgam, because friction will cause heat buildup. The critical temperature for pulp damage is 140 degrees Fahrenheit. On a patient, rinse frequently with the air-water syringe to cool and clean the surface. When using a typodont, use wet gauze. The amalgam surface should be smooth, free of defects, and have a shiny appearance. There should be no voids or dull areas. Remove the green stone and insert the brownie point. Apply moderate pressure with the brownie point to polish the grooves on the occlusal surface. Rinse the surface to cool and to clean. On a patient, this would be done with the water syringe. Use the brownie cup to polish the cusps and interproximal surfaces. Flare the edge of the cup on the cusps and interproximally if needed. Rinse the surface to cool and to clean. Insert the less abrasive greeny point and polish the grooves on the occlusal surfaces. Rinse with water to cool and to clean. Insert the greeny cup and polish the cusps of the occlusal surfaces and the interproximal surfaces if needed. Rinse the surface with water to cool and to clean. The super greenies have a yellow band on the shank. Use the super greeny point to polish grooves on the occlusal surfaces. Rinse the surface with water to cool and to clean. Use the super greeny cup to polish the cusps of the occlusal surfaces and the interproximal surfaces. Rinse with water to cool and to clean. Inspect the surface for a high glossy shine that should look like a piece of aluminum foil. The finished amalgam should be smooth and have no visible scratches or rough margins.
So the brownies and the greenies, those are readily available in the dental clinic, in your simulation clinic, and they're very commonly used for polishing amalgams. The video also mentions that the critical temperature for pulp damage is about 140 degrees Fahrenheit. This is equivalent to approximately 60 degrees Celsius, obviously in American video there. That's the same concept as when we're profiing. We just need to be careful not to generate enough heat to damage the pulp. So being very conscious of that. As far as removal of amalgams go, we will do that within the simulation clinic environment when I see you next week. And if you have any questions regarding this lecture, please feel free to email me. Thank you.